Hello guys, namaste. So I forgot to say something in the last slide, guys. Okay, now we are already completed this. Okay, now I'm going to continue from slide here, right? 240. Okay, so right now here, guys, this slide is very important one. So I'll say something here. I have some mnemonics to share with you guys. Okay, now so here see hyperbilirubinemias they are in the both conjugated and unconjugated. Conjugated means what? This conjugated means it is direct bilirubin. Okay, also called direct bilirubin. Okay, now see here. Uh, Sometimes they will ask you not only which is conjugated and which is unconjugated, but they are also going to ask you some few questions. See all are see here. See all are. Um okay, see this is the Dubin-Johnson syndrome. Okay, na Dubin-Johnson syndrome. What is the enzyme deficiency? Okay, na what is the enzyme deficiency? This is the what amma. This is the MRP. Defect in the where amma? Defect in the MRP means how we are going to remember. See Dubin-Johnson syndrome. See Johnson. See Johnson baby. There is a Johnson baby powder na. The Johnson baby powder. The MRP is very high. So MRP. Okay, Johnson baby MRP. Johnson baby MRP defect. Okay, na MRP to do defect. Okay, na see D for Dubin, D for dark. D for Dubin, D for dark. There is a dark liver. Okay, na then next one the motor is rotor here. Rotor what happened? Rotor is having what problem in the transporting. Rotor motor rotor motor and transporting. Okay na so the defect in the what am transporting anion transporting. Okay na done. Next one the here Gilbert syndrome. See Gilbert syndrome, this is very mild. Look, this is very mild. Remember in Crigler-Najjar type 1, there is a complete absence. There is a complete absence of the UDP, what? UDP glucuronide transferase. There is a completely absent. Okay, that's why it is the most fatal. Coming to the type 2, guys, coming to type 2, in this one, there is a what? Okay, there is a partial absent. Okay, there is a partial absent of the UDP glucuronide transferase. Okay, na? But coming to Gilbert, there is a mild absent. That's why there is no more symptoms in the Gilbert. But in type 1 click there, it is a most fatal. Okay, na? See, Gilbert is okay, na? Gilbert syndrome, it will seen in when in our conditions like any stress conditions or illness or fasting. Okay, na? It will show us the mild hyperbilirubinemia. Okay, now so out of all these, which is autoimmune dominant? It is a type 2. Okay, na? Remember sometimes this Gilbert also act as a autoimmune dominant. Okay, na? If there is no Crigler-Najjar type 2 in the option, then you can go with the Gilbert. Okay, then okay, we are here. So these are the questions. So they are the image based. They are going to ask in the exam, guys. So they just okay na study smart. Okay na they are going to give this image. Okay, and this is like this one means this is the mugging. This is mugging with what your elbow here. This is what this is garroting. Garroting means what with the by using ligature. Okay, by ligature they are attacking here. This is what this is smothering. Smothering means what it means smooth like that. They are going to block your oral or nasal. Okay, nose. They're going to block your nose. Okay, involves the external respiratory orifice either by the hand or any other means. So this is called as smothering. They're going to, as you see in this type of in many movies. Okay, in serials they're going to kill the. Okay, this is the bansudala. Bans means what? There is a bamboo stick. With using bamboo stick, they're going to put the neck here. This is called a bansudala. Okay. 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 Done. Okay. Next one, so study smart. Okay, go with only images. Okay, na this is what this is the tacnoid of sclerotica. If you want to know, then study this one. This is what rigor mortis. This is rigor mortis. This is the what liver change. This is the liver mortis. The just color changes here. Okay, now if you want to go in detail, then go. Or else no need to go in detail. Okay. Next one. This is what this is the lipo. This is adipokine. This is the adipokine. This is our saponification. Okay, na? This is mummy. This is mummy. This is also called as watama. This is mummification. Once upon a time, they ask the question like that one. In mummification, what does smell? There is a no smell. There is a no smell here. Okay, na? This is the marbling. Due to watama, there is a in marbling. What is the most common or what is the most common bacteria? It is the watama. It is responsible is the Clostridium welchii bacteria. Okay, na? Okay, done. Just remember the images. That's it. Next one, they're going to give this image, which is the caput succidum and the cephal hematoma. Okay, na, I think you guys are easily get this question. But remember, they are going to ask you which one crosses the uh, which one crosses the suture line? Which one crosses the suture line? See here, this is the caput succedaneum. See, succedaneum success. If you success in your life, you will cross the limit. So, succedaneum success. So caput succedaneum is crosses the what suture line. Which one is resolves within 40 to 48 hours? It is the caput succedaneum. Which one persists up to few months? It is the watama. It is the cephal hematoma. Okay, then next this is the Anemia Mukt Bharat program. This is the Anemia Mukt Bharat program. Okay, na remember here this remember they are going to ask you one thing here. What is the supplement here? 60 milligrams of iron and 500 mcg of what folic acid. You have to give. Remember, folic acid. See, I want to make you one clarity here. The folic acid. Okay, na. See, folic acid is very important. You know, because it prevents what NTD. Okay, na. See, actually, folic acid normal dose how much? 400 only. How much? 400 only. Okay, na? But here in the case of the Anemia Mukt Bharat program, it is a 500 mcg. It is a 500 mcg. And also remember, in the case of previous NTD, previous neurologic defect women's and seizures they have to take how much? 500 mcg, or else everywhere you have to mark the 400. Please check the question. They are saying the previous history of NTD, seizures, or are they asking about the Anemia Mukt Bharat program? Then only mark the 500, or else you have to mark the 400. Okay, done. This is the 6 into 6 and the 6 program. This one 6 beneficiaries, 6 interventions. Okay, now you have to know. Okay, Nara. So 6 into 6 into 6 program. See here. I think no need to remember this one, but just remember the folic acid and the dose here. Okay, na? And also remember these 6 interventions. Okay, na? 6 interventions, 6 beneficiaries, and 6 institutions, institutional mechanisms. These are okay. Na? These are schemes under what? This is the Anemia Mukt Bharat program. Okay, na? They are going to ask this one. They're not going to ask what are the 6 beneficiaries. They are going to include no, nothing. Okay, na? Just 666. What is the Anemia Mukt Bharat program? You have to do the deworming also, giving the albendazole. Okay, na? For the okay, na? So then, can you tell me, guys, one thing? When does the World Deworming Day? Okay, na? World Deworming Day. Just comment. Okay. Next one coming to here, guys. This is the ruler. This is the ASAS. Okay, na? Package of ASAS. So you have to ASA here. So how much there in the low performing states and the high performing state in the states. So sometimes they're going to ask the questions. So, for example, in the rural areas and the urban areas, how much does ASA's package? How much does ASA receive in the rural area? They will mention everything. So in the low performing, okay, in the, so for example, they will ask you in the low performing states, how much does ASA package in rural areas? So you have to give how much, 600 rupees. They are going to, government will give. Okay, how much? 600 rupees, 1400 for the mother. This is because to promote what, amma? To promote deliveries at the hospitals only. Say no to home delivery. By just promoting the to deliver safe. That's why the ASAs will working for to what? To make the deliveries at the hospital only, to avoid the death of the fetuses. Okay, now babies. That's why. So these are the these are the packages. Okay, now you have to remember in the rural and urban. So what is tracking a blood pressure? Taking a blood pressure means what, amma? See here. Okay, this is the time, this is the time, this is the BP. Okay, na? So see example. Okay, see example. See from child. See from childhood to adolescence. See, from childhood to adolescence, to you to at your see from at the 14 to at the age 30, 40, 50, 60. Okay, na? How much the BP is now? Okay, na? How much the BP is now? It will continues to be in the it will continues to be same as the age grows, as the age grows. So for example, if your BP is 120 or if your BP is 130, then it will continue, it will continue increasing. It will be high only as you grow. Okay, na? That's why if you are having low BP, meaning in the lifelong your BP is going to be low only. In the adolescent, okay, na, in the adolescent, early childhood to adolescent, you have to always check the BP, so that you will know that what are the problems you are going to face, and what are the preventive measures you are to give to the children. So that's why BP measure, BP trafficking is blood pressure tracking is very important. Okay, na? Tracking is very important. Okay, see here. If your blood pressure levels of individual are followed up over a period of years from early childhood into adult life, then these individuals who pressure high in the distribution would be properly continued same in the distribution, continue to be the same tracks as adult. Okay, now from early childhood to adult. Okay, now from childhood to adolescent period, you have to monitor the BP. If there is a same one with the low BP, it will continue to be low BP only. Okay. These are some poll devices. Okay, na? These are some poll devices. So this is the waterma. This is lipids to do. This is lipids to do. This is the first generation. It is having the most. Okay, na? This is the highest failure among the all ICDs. This is waterma. This is the copper T. This is the copper T 380. So this is second generation. It will protect you until waterma until 10 years. Okay, na? 10 years. And there is a one thing. There is a multi loaded copper T. It will protect you until 5 years. Okay, na? It will protect you until 5 years. This is Marina. Okay, this is third generation actually. Okay, na? This is the Watama. This is the DMPA. This is the DMPA injection. So the dose is 150 milligrams. So you have to take once in 3 months. Once in 3 months. Okay, now this is Chayara. This is the once a week pill. This is Saheli. Okay, now this is Malayan Maladi. They are going to ask you which one is available in shop free. It's D. Maladi is available as a free of cost. Okay, D for Dukan, D for free. Okay, D for Dukan, free. Okay, now I told you already which one you have to take in the emergency contraception in the emergency contraception lecture. Okay, now done. Next time coming to here, we having the measles, rubella, and the mumps. The discussion, measles. There is a there is a there is a coplic spots here. Okay, now there is a coplic spots here. Okay, now couple spots here, and also there is a what? This is couple spot. There is a morphily formed rash starting from the what face at the what behind the ear. Okay, behind the ear. The what are the chief complaint having? Cough, coryza, conjunctivitis. Okay, cough, coryza, conjunctivitis is the what chief complaint. Remember, what is the most common complication is the otitis media. It is the otitis media. Death is the pneumonia. Okay, na long term treatment, long term complication is what amma SSPE. Okay, na okay. Next one. Okay, then coming to here, rubella. See rubella here. This is also called as German measles. Okay, na. See here. What you have to remember this one, right? In rubella, what happens here? There is a what am I? There is a here. See here, प्यार में अंधा बहरा. Okay, प्यार में अंधा बहरा. PR means what amma? The complication is what? Congenital rubella syndrome. It includes what amma? PR means what? It includes PDA. Andha means what amma? Is a cataract. Behra means what amma? It's called what? SNHL, hearing loss. Okay, na? Hearing loss. This is the complication of what amma? What is rubella syndrome? The congenital rubella syndrome. Congenital rubella syndrome. Okay, na? Done. Next comes the mumps. Mumps is very important. Mumps here. Mumps is very important. Okay, na. See here, mumps. The main important one is that what is the rubella? Yes, this is the rubiola. See, rubiola is so rubiola is what? Yeah, measles. Okay, done. Next one, mumps. Here they will ask you what is the most common complication. It is the what amma? It is the most common complication is the what? Orchitis. It is the orchitis. It is the what amma? Orchitis is the orchitis. Orchitis in children, which is a bilateral. It is the bilateral or unilateral orchitis. It's unilateral orchitis. Okay, na? Let me check this one. I actually I didn't study the for a long time. That's why I'm getting the doubt. That's why I want to clarify. I want to clarify you guys. Don't want to do. I don't want to make you mistakes. That's it. Done. Okay. See here. Momsra. Okay, na there is a what there is a chief complaint what there is a what there is a bilateral what there is a bilateral paratitis. There is a bilateral paratitis. And the complication is what complication is the orchitis, which is a unilateral. Okay, na? In females, it causes the uphiritis. What is the vaccine here? Geril. Okay, na? Geril. Then stain. Okay, na? For the measles, what is the vaccine here? What amma? Is Admoston. It is the Admoston. I think everyone knows this one. Okay, Admoston is this one. Done. For the rubella, what is the vaccine is here? RA 27/3 Winston. Okay, na? Done. So these are important. Okay, these are very important. Done. It. Yeah. So these are very important. Just remember this one. Okay, na? Measles, rubella, mumps are very important. I already discussed this one in the main lectures, and also it is available in the Telegram also. Okay, na? Separate lectures. So this one they're not going to ask this one, but remember sometimes we are going to give these images. You have to remember this is the yellow oleander and the pink oleander. Okay, now see here, these tables are very important. Disease and exposure sources. What is silicosis? Silica. Among this one, see, all are very easy. Remember one thing here. This is the bicynosis and bagosis. See, bicynosis. See, this is the bicynosis. See, Baika basu. Baika basu. Bai means what? Bycinosis. Ka means cotton. Baika. Basu means what? Basu. Bagosis. Su sugar. Su sugar. Basu means sugar. And bagosis. See, bycinosis. Baika. Baika means bycinosis. Ka cotton. Basu. Bagosis. Su means sugar. Okay, na done. These are very important. These two are very important. Absolutely. This next one coming to the agent which causes the cancer here. Um, Asbestosis mesothelioma. Okay, na causes the as mesothelioma. You have to check the question that you have to check the question first of all. Okay, na what at what chemical that they are talking about. If they are talking about that the patient is having the exposure with the asbestosis, obviously the cancer causes the mesothelioma. Arsenic is skin and lung cancer, benzene leukemia, and cadmium and beryllium or lung. Okay, now nickel, nasal sinuses and lung. Uh, ethylene oxide is the leukemia. Okay, na? These two are important. I already discussed about this one, family cycle. Okay, na? See, sometimes they are going to give in the PSM guys what is belief, what is attitude, what is habits. To remember the just definition is important. Okay, na? See, among this one, just remember the no need to remember the intelligence, but only remember the IQ. What is the normal? Okay, now what is the normal? Okay, what is the normal IQ? Not normal, what's the mild? Mildly 50 to 70. Okay, now remember this only. Remember only this. Remember only this. Okay, now this is the what? What is the mild? It is the 50 to 70. That's it. Nothing is important here. Okay, so next one here. There are some here from the PSM only. What is dichotomous variables and polytomous variables? Okay, na? So example in the gender, it is what amma? The gender example only the male female. Okay, na? Male female, obesity, thin or fatty, temperature for less than or more than. Okay, na? That's it. But here we'll see the weight in kgs in many things. Okay, na? In LLB something. Okay, with having more than 2 positive values. Okay, na? Weight by having more than 2 positive values. Okay, na? Okay, na? Then discrete variables and continuous variables. Here, check this one. Okay, this I discussed this one in the earlier part. This is the quantitative variables and the qualitative variables. Okay, now quantitative variables, it is variable that can be measured directly. It cannot be measured directly. Means it is a qualitative directly. Okay, now weight we can measure directly. Height we can measure directly, but ABO will blood group like gender, size of lymph node, we cannot measure it directly. Okay, now. So these are very, very small topics, okay, na? You have to remember. So this one, they are going to ask you what is Sullivan index or disability-free life index? Definitely. So it is means what? It is the expected. It is the expression of life-free disability. Life-free disability if current pattern of disability continues. Okay, this is the which is the life-free, which is the life-free of disability. It is the what amount? Definitely. And what is the hele? Hele means what amma? It is measures the healthy life. Healthy life. What is the healthy life expectancy, which means the hele. Okay, na? Next one is the daily. Daily means what amma? Year of life, year of lost life plus years lost to disability. Okay, na? So for example, you are 70 years old. If you are for example, you are 70 now. Okay, na? How much year you, okay, na? How much year of last means, for example, you are uh 70 only, na? You stayed happily, you live a life, healthy life until 54 years, and from there to 70 years. Okay, na? So for example, okay, 70 years, and from see from 54 years, from 1 to 54 years you stay healthy. From that onwards, actually the expected life of Indian is 70, 65 to 70 only. Okay, na? So 54 years you stayed healthy, then remaining your years you stay unhealthy, year of lost disability. That is totally the daily. Next is the quality. Next the quali. Quali means what am I? It measures the disease burden. Okay, disease burden including both quality and quantity. This one very important. I taken from this one from the PSM textbook only. Okay, now see here. Sometimes they are going to ask the question. So according to the CD4 value count. So 500, 200, 50, and if it is less than 500, if less than 200, less than 50, less than 500, less than 200, less than 550. I don't know how you are going to remember, but you have to remember there is always one MCQ from this one. Okay, now remember. Last time they asked you toxoplasmosis. Cryptococcus is very important. I think everyone knows this one. Cryptosporidis is also important. CMS, histoplasmosis is important. Okay. Always they're going to ask from this year, from this one. Remember. Okay. Now just try to master, mug up. Okay. Now try to do anything, whatever. Just you have to remember. Even I too don't know. Okay. Now, but I'm also a student, so I have to mug up. Okay. Now. Come to HIV, what are the major and minor signs? They're not going to, okay, not going to ask you in the exam, but just for your knowledge purpose, I kept this one. Okay, now these are very important. Okay, which is the confirmatory test for the HIV? It is the Western blot. Which is the screening test for HIV? Is the waterma? It is the ELISA. It is the ELISA test. It is the ELISA test. Okay, now as I said earlier that you have to know the waterma CD4 count. Okay, now here you have to remember this. Next one, what are the first line and the second line treatment? I think you guys already mastered this in your pharmacology, guys. Okay, na? In the pharmacology. So this is the PSM. Okay, we're not going to talk about the treatment plan. So these are the WHO clinical staging of HIV and AIDS for adults and adolescents here. But the stage 1, stage 2, stage 3, nothing is important here. And from the pharmacology based, guys, they are going to ask you which of the following drugs comes under the NRTIS and what is the NTRTS. Okay, they are going to ask you. They are going to give a set of drugs. So for example, Jidodine, Lamodine, okay, Abacavir. Okay, they will tell you which of the following is a NTRH, nucleoside reverse transcriptase inhibitor. So yeah, they're going to give this 3 and they're going to this one. So you have to mark the. So tenofovir is a nucleotide, not side. It's a nucleotide reverse transcriptase inhibitors. Okay, now that's how they're going to ask the questions. That's it from the HIV topic, guys. So these are the for the adults and adults. This is from the children's. Okay, now. Don't worry, they're not going to lag this one. From pharmacology, they're going to ask this same simple questions. Okay, na? Just remember what is the first and the alternate first line treatment. That's it. I told already this one. I think everyone knows about this one, smallpox and chicken pox. I discussed this already in our vaccination chapter. Okay, na? Okay, this one, food adulterants. Okay, na? Food adulterants here. I already discussed this one in the above slide, Lathyrgum boa. Okay, now remember, let's talk about the Lathyrgum. Lathyrgum what caused by what? Lathyrus sativus, commonly called as Khesari dal. What is Khesari dal? Beta, this is a what toxin, which is a neurotoxic. This is a neurotoxin. That is the beta oxalyl L-amino alanine. Okay, now this waterma, it causes the paralysis. What causes the waterma? It causes the spastic. It causes the spastic paralysis of the lower limb. It causes the spastic paralysis of the lower limb. Remember, what is the prophylaxis which you have to give the vitamin C. You have to give the vitamin C. You have to give the vitamin C in the prophylaxis. Okay, now remember. So don't study. Okay, don't study in depth. Just remember, Lathyrgum boa, Khesari dal, vitamin C is the prophylaxis, and what it causes the spastic paralysis of the lower limb. If they're not going to give if they're not going to give any on the option boa or Lathyrgum, if they are going to give okay, it is in the a UP student, a Bihar student, meaning not student, Bihar patient, meaning you ought to know it is a talking about the Lathyrgum. Next is the epidemic. Next is the epidemic dropsy. It involves what? Sanguine. Okay, now arginine oil content is active principal sanguine, which called the epidemic dropsy here. So what happens? It is a sudden onset. It is having the sudden onset of diarrhea, dyspnea, glaucoma. Okay, now they are the someone. Remember, epidemic dropsy and lethargism very important. Okay, na? Just you remember just they are going to give the images and you have to identify. Okay, na? Just study smart. So this is important one. This is the fistulas. This is the fistulas. Okay, na? Urinary. If this is the urinary. This is the urinary fistulas. This is from the OBGYN. See, please read the question first. What will be the most likely diagnosis of the middle swab is stained with the dye in the blue? What will be the most likely diagnosis if the middle swab is stained with the dye in the methylene blue 3 swab test? Okay, na? See, what they asked, middle swab, meaning what is middle? Okay, let's go. See, here, this is the, what is fistula means? Tell me. Fistula means what? There is a connection. There is a connection between the one skin to one skin. Okay, there is connection between the one skin to one skin. Okay, na? One part to one another part. Okay, na? Take this one. This is the water. This is the bladder. Okay, na? This is the your bladder. This is the urethra here. This is the water ureter here. This is the ureter. This is the vagina here. If ureter is going to form the fistula between the ureter and the vagina, this is called as what? Ureterovaginal. If there is a fistula between the bladder and the vagina, then it is what? Vesico-vaginal. Vesico means what? Bladder only. We say vesico-vaginal. If there is a fistula between the urethra and the vagina, it is called as what? Urethro-vaginal. That's it. See, it's very clear. Okay, now remember once again I'm telling, if there is a fistula between ureter and the vagina, it is called as ureterovaginal. There is fistula between bladder and the vagina, it is called as vesico-vaginal. If there is fistula between the what? If there is fistula between the urethra and vagina, is called as ureterovaginal. It is called as ureterovaginal. It is called as ureterovaginal. It is called as ureterovaginal. Okay, now done now. See, okay, so let me take a snap here. Okay, take a snap here. Okay, here. So done now. Let me know. See, what will happen if there is a fistula? Okay, first of all, coming to the ureterovaginal. If there is a connection between, if there is a fistula between the ureter and the vagina, what happens? See, whatever the urine coming from the ureter, it will go from here. It will goes to where, amma? It goes to vagina. Then there is a dribbling of urine there. Okay, na? But see, however the urine is coming from here, however the urine coming from the another bladder is going to fill the bladder. Then there is no problem in the urination, because the bladder is filling. So the patient will not feel there is a bladder emptying. So there is a normal, okay, there is a normal urine flow only, but there is something, only one thing is important here. Only from the one bladder is going to what, amma? Is going to the urine is going to flow in the vagina. That's why there is a what? Dribbling from the vagina. Next, now coming to here, listen carefully. If there is a fistula between the bladder and the vagina, what happens? See, all the urine from the bladder is going to what? Is going to vagina, isn't it? So there is a wet. So there is a what happened? So there is a continuous. there is a continuous dribbling. There is a continuous dribbling, isn't it? But there is no normal urination. Okay, na? No normal urination, na? Because the bladder is empty, na? Then how come all the urine will be coming from the vagina? Okay, next one, urethrovaginal. See here, from urethra, guys, from bladder, okay, na? From after filling bladder only, okay, na? If after filling only the urine will flow, or filling only urine will flow, na? Then only, na? Isn't it? That's why if there is a fistula between the urethra and vagina, does is there any dribbling of urine in normal condition? No. Why? Because if the bladder is full only, then only urine will come from the urethra. If the bladder is not full, then how come the urine will come into urethra? So there is no urine is coming from the vagina. There is no dribbling of urine. But once the patient is going for the urination, the urine will from the urethra is coming into the in the vagina. So these are the scenarios you have to know. Okay, na? Next one, Ra. In order to identify this one, Ra, we are going to do the swab test. We are going to do the swab test. This is called as swab test to identify the type of urinary fistula. Okay, na? See, we are going to take a dye with methylene dye. Methylene dye. We are going to keep 3 dyes. Okay, na? One is at the here near the upper, at the where from vagina to where ureter side vagina, upper side of the vagina. Next is the middle side of the vagina, and the next one is the introitus. Okay, na? See what happens. These three are what these three are with the water colored. Okay, na? Colored one, colored blue. See here, if the urine will from the uterus, from the ureter, okay, na? From the ureter, here the dye. If the urine, if there is a, this is one, urine will come. What okay, na? Urine will come here. Okay, na? Urine will from ureter to vagina. It will come to vagina. Then what happened? The swab will be what the cotton swab will be wet, and this wet, okay, na? Because of this urine, what happens, the color will changes. Okay, na? Then why? That's why there is a wet urine with no color. Okay, na? Next one, coming to this swab. What happens, there is a connection here. What happened? Here is the dye. Okay, na? Here is the dye. Okay, na? Here is the dye. This dye, wow, this dye, okay, na? You have to keep the dye here also. Dye. This will what happen? This dye, okay, na? This dye, what happens? It will goes to what, it will goes to your vagina. Okay, na? Then what will happen? There is a this cotton, okay, na? This cotton will change the color. Because why? You put the dye here in the bladder. From the bladder, guys, the dye will be coming to the vagina. That makes the cotton that makes the cotton blue. Okay. Next one here. See, both upper and both lower and middle, the swab will be changes to color only because there is a connection here. Okay, now see here. Now coming to here, from here also there is the swab will be wet, and it will change the color to blue, isn't it? Because the dye here. Okay, na? These are the cotton, here cotton. You have to put the dye here. If there is a no color, if there is color changes, then it will be middle or lower. No changes, it will be what, your upper. Okay, done. Remember one thing, for the VVF, vesicovaginal fistula, you have to do the what? There is a Chaser Moyer. This is a Chaser Moyer technique. Okay, Chaser Moyer technique. But bathroom glands, okay, na. I think also everyone know this one, okay, na. What is for the bathroom cyst? You have to do the marsupialism is the treatment of choice. Okay. See this one, the indications and the recommended dose of anti-D. Okay, na. Recommended dose of anti-D here. In the first trimester of abortion, you have to give the abortion or MTP. You have to do the how much? Recommended is how much? 50 microgram. Second trimester abortion, you have to give the 300. For the prophylaxis for prophylaxis at the 28 weeks, so how much the 300 microgram. After delivery, RS positive baby, you have to give the 300 mcg. Okay, na? This is very very important. This one. Triple market, quadruple market, dual market. So you have to know that the triple market at the 11, 16 to 18 weeks, 16 to 18 weeks, quadruple market, and the dual market 13 to 11 to 13 weeks. You have to know the what is the importance situation here. HCG levels, AB levels, stadia levels. Okay, na? Remember here. Here the fundal height, okay, na? Below umbilicus at 20 weeks, above umbilicus at 24 weeks. They are very simple. Here the mammogenesis, lateral sequences, mammogenesis, lactogenesis, galactogenesis, and the galactopoiesis. They are the order of the. This is the order of the. This is the order. Okay, and also remember the uterus height, heart rate at 12 weeks at the PV symphysis, level of the umbilicus at the 24 weeks of umbilicus, and yes, okay, na? Yes, important. Okay. This comes to the hyperthyroidism, the hyperparathyroidism. Hyperparathyroidism, there is a this is a ruggery. Okay, there is a ruggery jersey. Okay, ruggery jersey spine, ruggery jersey spine, and a salt and pepper skull here. This is a we'll see the brown tumor. The brown tumor at the first bone reception. Okay, and remember, what is the here? Okay, what is the instrument of choice? Is the technetium 99 Shasta maybe scan for the hyperparathyroidism. Okay, na? This is very important from this one. Okay, this is septic shock. You have to remember this is the criteria for the diagnosis. Okay, and for the management, these are the steps. 1, 2, 3, 4, 5 steps here. Just remember. Remember how much crystallized you have to give. There is one question in the exam that is 30 ml per kg. Okay, okay, na? So done. See, this is the hepatitis A, hepatitis B, C, D, and okay, na? Just you have to remember this one. This table is important, okay, na? Which is the deadliest one? This is the hepatitis D, which is from the most important in the like after pregnancy, which is occur in pregnancy, it is in the hepatitis E is occur, which is from the fecal, it is the hepatitis A. Okay, na? Very important one. Which is double stranded DNA. It is the hepatitis B. Hepatitis B. So I think that's it, okay, na? We are going to end this one. Hypertrophic and the keloid. Everyone know this one. Okay, na? Okay. Then okay, next one we are having these are all our images. Okay? These are all our images only. It's your job. Okay, it's your job to finish this one. Okay, na? All are the images only. They are very 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 important one. You have to remember. These all are the images only. Okay, na? You have to remember. Faber, this one Faber Fadir is very important. Okay, na? So okay, guys. So all the best, guys. So okay, all the best. You will do it. Okay, you will do it. I will try my best for the upcoming FMGE also. So if you have any more doubts, you can just WhatsApp message me. Okay, call me. So before calling, text me. Okay, and introduce yourself. Okay. Thank you very much, guys. See you. Okay, now. Thank you.